There are moments in medicine that nobody warns you about, moments where something that sounds minor, something you might brush off as just a bad day, turns out to be far more serious than anyone imagined. And today I want to talk about one of those moments, because in emergency medicine, I have seen patients come in embarrassed, uncomfortable, and genuinely suffering from something that could have been prevented weeks earlier if only someone had told them what I am about to tell you. I am Dr. Zack. I work in emergency medicine in the United States. And before you click away thinking this topic does not apply to you, I want you to stay with me for just 60 seconds because what I am going to share today is something that affects millions of people silently, something most people are too embarrassed to Google, and something that a colorectal surgeon colleague of mine recently broke down for me in a way that genuinely changed how I think about digestive health. If you find this kind of real, honest medical content valuable, I would love for you to subscribe to this channel right now. We do not do clickbait here. We do doctor-level education, plain language, no nonsense. Hit that subscribe button and let us get into this. So, stool stuck in the rectum, fecal impaction. Even saying the words out loud feels uncomfortable for most people. But here is the thing, discomfort with words is exactly why this condition gets worse before anyone does anything about it. People wait, they hope it resolves on its own. They drink a glass of water, maybe take a laxative from the pharmacy shelf, and then wait some more, and the clock keeps ticking. Here is what is actually happening inside your body when stool becomes impacted in the rectum. The rectum is the final holding chamber of your digestive system. It's just above the anus, and its job is to temporarily store stool until your body signals that it is ready to expel it. Under normal conditions, this process is elegant and automatic, but when stool sits in the rectum for too long, something goes wrong at a cellular and mechanical level. Water continues to be absorbed from that stool. The longer it stays, the harder, drier, and more compacted it becomes, and here is where things get interesting. Once that stool reaches a certain density, the normal muscular contractions of your colon, those gentle waves that push everything forward, can no longer move it. The system stalls, and what was once a manageable situation becomes a genuine medical emergency if left unaddressed. The rectum begins to stretch. That stretch activates stretch receptors in the wall of the rectum. Those receptors send signals to your brain that you need to go. So you feel the urge, you go to the bathroom, you sit there, nothing happens or almost nothing. Maybe a small amount of liquid stool seeps around the impacted mass, and this is one of the most dangerous and misunderstood signs in this entire condition. Liquid stool leaking around a solid impaction is not diarrhea. It is paradoxical diarrhea. It looks like a stomach bug. It looks like a gut infection, and so people treat it like one. They take anti-diarrheal medication, and they make everything dramatically worse. That is the part most people miss. If you or someone you love is experiencing what seems like diarrhea, but also has not had a proper bowel movement in days, that pattern deserves immediate medical attention. Do not treat it at home with over-the-counter anti-diarrheal drugs without first confirming what is actually happening. I want to say that clearly, and I say it not to scare you, but to give you the knowledge to act correctly. Now, who is most at risk here? The picture is broader than most people think. Yes, older adults are disproportionately affected. The muscular contractions of the colon naturally weaken with age, mobility decreases, hydration often suffers, fiber intake drops, medications like opioid painkillers, certain antidepressants, iron supplements, and calcium channel blockers all slow gut motility significantly, but younger people are not immune. Long periods of immobility, dehydration from illness, neglecting the to-go repeatedly over time, low-fiber diets, and certain neurological conditions can all set the stage for impaction regardless of age. And here is a behavioral pattern I want you to think about. How many times in your life have you felt the urge to use the bathroom and suppressed it because you were in a meeting or on a trip or just somewhere inconvenient? Your body gives you a window. That window is real. When you ignore it repeatedly, you train your rectum to stop sending the signals as urgently. Over time, the threshold changes, stool stays longer. Drying begins. The cycle builds quietly over months and years before it becomes an acute crisis. Let us talk about the 1TSP that is mentioned in the title, because this is where the science gets genuinely fascinating and where my colorectal surgeon colleague absolutely floored me in conversation. What we are talking about is something that has been used in clinical medicine for decades, something low risk, widely available, and backed by actual physiological mechanism. We are talking about olive oil, specifically around 1 TSP of extra virgin olive oil taken orally, ideally first thing in the morning on an empty stomach. Now, before I explain why this works, let me be absolutely clear about something. Olive oil is not a treatment for severe or complete fecal impaction. If you are having significant pain, you cannot pass stool at all, your abdomen is distended, or you have any signs of obstruction, you need to go to an emergency room, full stop. What we are discussing here is the role of olive oil in supporting rectal motility, softening stool, and stimulating natural bowel movement. In cases of early or mild constipation and sluggish rectal evacuation, this is not a miracle, it is a mechanism. Here is the physiology. Olive oil is rich in oleic acid, a monounsaturated fatty acid. When oleic acid reaches the small intestine, it triggers the release of something called cholecystokinin, a gut hormone that stimulates contraction of the gallbladder and the secretion of digestive enzymes. But it also has a direct effect on gut motility. It essentially tells the intestinal tract to move. On top of that, olive oil has a lubricating effect on the intestinal wall. It reduces friction. It makes it easier for stool to slide through and out. And one key study published in the Journal of the Academy of Nutrition and Dietetics found that olive oil was comparably effective. 2. Mineral oil for managing constipation in dialysis patients. A population where constipation is both common and difficult to treat. 1 teaspoon. First thing in the morning, empty stomach. That small act can be the difference between a bowel movement happening within 30 to 60 minutes and a day of discomfort and frustration. It is not dramatic. It is not a shock to your system. It is a gentle biochemical nudge that works with your body's own mechanisms. But it only works in the right context, and it is not the only piece of this conversation, because the bigger picture here is about rectal health as a daily practice, not an emergency response. Fiber is foundational, and here is where most people get it wrong. They hear fiber and they think bran cereal. They add a little bit of fiber to their diet and see no change and they give up. But fiber has 2 forms and both matter. Soluble fiber, found in oats, apples, flaxseed, and legumes, absorbs water and forms a gel that slows digestion and softens stool. Insoluble fiber, found in whole grains, vegetables, and wheat bran, adds bulk and speeds transit time through the colon. You need both, and the amount matters. The average American gets somewhere around 15 grams of fiber per day. The recommended minimum is 25 to 38 grams depending on age and sex. That gap is not a small statistical difference. That gap is a daily driver of constipation across millions of people. Hydration is the second piece, and this one is criminally underestimated. Fiber without adequate water can actually make constipation worse. Think of fiber as a sponge. Without water, it does not work. It sits in your colon. Dry and adds to the problem rather than solving it. You need enough fluid for that fiber to do its job. For most adults, that means somewhere between 6 and 8 glasses of water per day as a baseline, more if you are active in a hot climate or consuming significant amounts of salt or caffeine. Movement is the third piece. Your colon has a direct relationship with your body's physical activity. Walking in particular stimulates something called the gastrocolic reflex, which is the same reflex that makes you feel the urge to use the bathroom after a meal. When you move your body, you move your gut. People who are sedentary have consistently slower colonic transit times. Even a 20-minute walk after meals can meaningfully reduce constipation risk over time. And then there's the question of position. This one surprises people. The human rectum and anus are not perfectly aligned when you are seated in a modern toilet position. The puborectalis muscle forms a kind of kink in the anorectal canal when you are seated upright. This is a natural design feature that maintains countenance, meaning it helps you not have accidents. But that same kink makes full evacuation harder. When you squat or use a small footstool to raise your knees above your hips, that muscle relaxes, the anorectal angle straightens and stool passes with significantly less strain. This is not folk medicine, this is anatomy, and it is supported by studies showing reduced straining, less time on the toilet, and more complete evacuation with the squatting posture. I have patients who have struggled with incomplete evacuation for years, who feel like they never quite finish, who spend more time in the bathroom than they should, and when I ask them about their toilet posture, they have never once considered it. A $6 footstool from a pharmacy can genuinely change that experience. We are at the middle of this video, and I want to pause and say something. If you are getting value from this kind of detailed, science-backed medical content, please subscribe to this channel. Share this video with someone in your life who deals with constipation silently, because that person exists in almost every family and they deserve real information, not shame and silence. Now let us talk about warning signs, because not all constipation is equal, and part of what I want you to take from this video is the ability to distinguish between something you can manage at home and something that needs professional evaluation if you have not had a bowel movement. In more than 3 days, in olive oil, hydration, fiber, and movement are not helping. Call your doctor. If you are experiencing significant abdominal pain or cramping alongside the constipation, do not wait. That level of discomfort warrants evaluation. If you notice blood in your stool, even a small amount, even if you think it is just hemorrhoids, mention it to a doctor. Blood is always worth evaluating in the context of a change in bowel habits. If you are experiencing a significant and unexplained change in your normal bowel pattern, meaning you are someone who has always been regular and suddenly find yourself chronically constipated, that is a conversation to have with your healthcare provider. Changes in bowel habit that are new, persistent, or accompanied by weight loss, fatigue, or abdominal bloating should be investigated. This is not meant to alarm you, it is meant to give you the knowledge to advocate. For yourself, colorectal surgeons and gastroenterologists are not people you should be embarrassed to see. The colorectal surgeon I spoke with recently described it simply. He said that the patients who suffer most from impaction and chronic constipation are the ones who waited too long to talk to someone because they were embarrassed. And he said that in his entire career, he has never once judged a patient for a bowel complaint. What he has seen is people who suffered unnecessarily for months or years because they assumed the conversation would be awkward. Let that land for a moment. The practical summary here is this. Take 1 tsp of extra virgin olive oil in the morning on an empty stomach. Eat both soluble and insoluble fiber across your meals. Drink enough water to give that fiber the medium it needs to work. Walk after meals. Use a footstool to optimize your evacuation posture. Respond to the urge when it comes. Do not suppress it repeatedly. And if something feels wrong, persistent, painful, or unusual, talk to a doctor. Not next month. Soon. Fecal impaction is not a punchline. It is not a minor inconvenience. Left untreated, severe impaction can cause rectal tears, pressure ulcers, bowel obstruction, and in the most extreme cases, a condition called stercoral perforation, where the pressure of impacted stool actually perforates the bowel wall. That is a surgical emergency with a high mortality rate, and it almost always began as something manageable that was ignored for too long. I want you to take this video seriously, not because I want to frighten you, but because I genuinely believe that the gap between a life with easy, comfortable digestion and a life defined by chronic constipation, discomfort, and eventual crisis is smaller than most people think, and almost all of it comes down to daily habits and the willingness to pay attention to what your body is telling you. Your gut is not an afterthought. It is connected to your immune system, your mood, your energy, your sleep, and your long-term metabolic health in ways that science is only beginning to fully map. When your gut is sluggish, you feel it everywhere, and when it works well, the effect is real, tangible, and life-improving in a way that is hard to overstate until you experience it. This is what medicine looks like when it is honest. Not miracle cures, not fear tactics, just physiology, practical tools, and the respect of giving you complete information so you can make real decisions. 1 teaspoon of olive oil, eat your fiber, drink your water, move your body, respect the urge, optimize your position, know the warning signs, and never be embarrassed to talk to your doctor about what your gut is doing. That is the real takeaway from today. If this video gave you something useful, something you will actually remember, something you will share with your mom, your spouse, your friend who you know struggles with this quietly, please do that. Share it. It costs you nothing and could genuinely make a difference in someone's health. And if you are not subscribed yet, please subscribe now. Every video on this channel is built the same way. Real medicine, real clarity, no nonsense. I'm Dr. Zack and I will see you in the next one.